This is WFYI News Now. It's March 7th, and I'm Zach Bundy filling in for Abriana Herron. On today's show, students, parents, and educators wait hours to tell state lawmakers whether they want traditional school districts to share money with charter schools. The Lumina Foundation sets a goal to increase the number of people with education and training beyond high school. And long-awaited improvements at multiple Indy Parks are underway.
We wanted to see improved play space, so a new playground for kids. And we've also really seen a demand and interest in court sports, especially pickleball.
Those stories coming up. But first, the next installment of our segment called The Checkup from SideFX Public Media, where the health reporting team explores a single question sparked by a recent news story, or maybe by one of our listeners.
The use of AI in hospitals in the United States is wide-ranging, with roughly 2/3 of U.S. hospitals using these predictive algorithms. But did you know that only about 60% of those hospitals are testing said algorithms for accuracy, and less than half are testing them for bias? So how can hospitals' use of AI affect patients? That's the Checkup's question for today. I'm Lizzie McGreevy, Community Engagement Specialist with SideFX Public Media. With me today is Ryan Levy. He is a producer with health policy news organization Trade-Offs.
Hey there, Lizzie.
Hi, Ryan. So what do we know about how and why hospitals are using AI?
What we're talking about right now really comes from some new research from Paige Nong at the University of Minnesota and others, and it's the first national look at how hospitals are using AI. And so, before we had obviously we've all been hearing about AI in healthcare. It's been a really big topic, but we haven't had actual data to say how widespread is this. And as you mentioned in your introduction, it's pretty widespread. But when we look at actually how hospitals are using these predictive models, this AI, what we see the most common way is to predict health trajectories or risks for their patients in the hospital. So like predicting the fall risk for someone when they're hospitalized, or predicting if someone's going to get sepsis. The second most common way that they're using AI is to identify high-risk folks who have left the hospital, who they may need to follow-up care. So if someone is at risk for an infection, they want to be able to predict that risk and intervene early. And the third most common way that hospitals are using AI is actually kind of administrative stuff, right? So like scheduling, billing, the more operational side of things. We're seeing a lot of AI used for that in hospitals as well.
Can you walk us through the bias concerns with AI use in hospitals?
Yeah, so these really date back to a famous paper from 2019 published by Ziad Obermeyer and some colleagues. And it found that there was this AI algorithm that was being used by a large health insurer to, again, predict people's health needs. And this algorithm was biased. It had used past health costs as a predictor for people's future health needs. The problem with that is, though, Black patients often spend less on healthcare because they have less access. And because that data that was used to train the algorithm was biased, the algorithm itself ended up being biased against Black patients. Those patients needed to be much sicker than white patients to get the same recommended care. And we know from interviews that Paige Nong, this researcher, has done previously, that a lot of hospitals are not scrutinizing their AI tools to make sure that, these biases that we all know exist in our healthcare system aren't being perpetuated by these AI tools. And so now, for the first time, we have some national data showing that this isn't just a kind of isolated concern, but this is actually a widespread issue across the country.
Okay, so if I happen to be a patient at a hospital that's using AI, should I be concerned about a misdiagnosis? Am I going to be seeing an AI quote-unquote provider instead of like an actual human doctor? What are the risks here for patients?
So we're still, even though the AI use is pretty widespread, it still may not actually be totally clear or obvious to a lot of patients that AI is being used in their care. It's unlikely to be an AI provider, a robot coming in to, take your blood pressure or anything like that. And Paige Nong, the researcher from the University of Minnesota, says based on her research, she's also not that worried about clinical errors, the misdiagnoses types of things, because hospitals have a lot of safeguards and protocols in place to avoid those, even before AI. She's more worried about patients being harmed by those non-clinical uses I mentioned, the scheduling, the billing. Here's what she had to say about that.
Their appointments might be getting cut short, but they don't know why. Or they might be having trouble with a bill and they can't get somebody on the phone. They might not know why. And it is possible that these kinds of predictive AI tools are shaping their experience of the healthcare system outside of the direct clinical care or outside of their direct relationship with their doctor.
And so are there enough guardrails to make sure that AI is used in a way that doesn't negatively impact some of these patients?
I mean, that's the big question, Lizzie. Some of the bigger hospitals like Mayo, Duke, University of California, San Francisco, they have pretty rigorous processes for kind of vetting and testing their AI tools. And there are large industry groups that are trying to pull together best practices that hospitals can follow here. But there's a lot of concern about whether particularly smaller hospitals and clinics that serve poorer and more marginalized communities will have the resources to make sure that the AI they're using is safe and effective. The Biden administration was very involved in pushing for more transparency and regulation in this space, but many people expect the Trump administration to take a lighter touch. Some folks think that will promote more innovation, but others are really worried that it could lead to patients being exposed to more bad and harmful AI.
Ryan, thank you so much for this information. To learn more, listen to Trade-Off's episode at tradeoffs.org. If you, dear listener, have questions about health, healthcare, some strange viral social media posts about health, let us know. Until next time, stay safe.
That was The Checkup by SideEffects Public Media. SideEffects is a regional health reporting collaboration of NPR member stations across the Midwest, based here at WFYI. Students, parents, and educators waited hours Wednesday to tell lawmakers at the Statehouse whether they want traditional school districts to share money with charter schools. A Republican-proposed bill would require certain school districts to phase in property tax sharing with charter schools beginning in 2028. Indianapolis Public Schools is one of them. IPS leaders told lawmakers they could face school closures, but charter leaders said the bill is about fairness for all students. The debate at the Statehouse lasted 4 hours. The bill has yet to be voted on by the House Ways and Means Committee. WFYI will continue to cover this story. For more stories on Senate Bill 518, go to our website. The Indianapolis-based Lumina Foundation is setting a new goal to increase the number of people with education and training beyond high school. From WFYI's Education Desk, Sydney Dauphiné has more.
The new goal, to have 75% of adults in the U.S. have a college degree or other credential by 2040. Jamie Marasotis, Lumina's president and CEO, says part of reaching that goal is making college and credential attainment worth it.
Confidence in higher education is at historically low levels. And so we need to rethink how education creates opportunities. We need to rethink how it drives success for individuals and for communities.
The organization works with state and federal policymakers to meet the goal. Lumina plans to focus on making college more affordable by addressing student barriers. They also plan on supporting up to 10 states in short-term job training. It's estimated in the next few years, more jobs will require post-secondary education. I'm Sydney Dauphiné.
The Trump administration proposed a list of federal property to be closed or sold, including 3 in Indiana. WFYI's Samantha Horton reports that included one federal building in downtown Indianapolis where an immigration court opened earlier this year.
A non-core property list released Tuesday by the U.S. General Services Administration included hundreds of federal buildings across the country. The Minton Capehart Federal Building in Indianapolis houses several federal agencies, including the U.S. Department of Veterans Affairs, the Internal Revenue Service, and the Social Security Administration. Most recently, the building became home to one of the country's newest immigration courts. Immigration advocates and lawyers were excited about the new location. They said it was needed to help address the backlog of cases. It is unclear what would happen to the court and other federal agencies located in the building should it be closed and/or sold. The other 2 buildings located in Indiana are the Major General Emmett J. Bean Federal Center in Lawrence and the Lee H. Hamilton Federal Building and U.S. Courthouse in New Albany. I'm Samantha Horton.
The Tuesday list has since been taken down with a message that said coming soon. And for our final story today, long-awaited improvements at multiple Indy Parks are underway. WFYI's Emma Matlock reports that recent investments have allowed for upgrades in many neighborhood parks, including 10 on the west side of Indianapolis.
Chapel Hill Park will receive $2.6 million in upgrades funded by a Lilly Endowment grant and the 2025 Indy Parks capital budget. Indy Parks Chief Communications Officer Alex Courtwright says the department worked closely with community members to get insight on needed improvements.
We wanted to see improved play space, so a new playground for kids. And we've also really seen a demand and interest in court sports, especially pickleball.
Right down the road, Cranard Park also has a playground planned alongside nearly $11 million in other upgrades already completed at the Family Center. An $80 million gift from the Lilly Endowment in 2022 has supported recent park improvements. Additional federal relief funds and city appropriations have also contributed to record park investment. I'm Emma Matlock.
This week, Indy Parks announced the start of construction on improvements for Franklin Township Community Park. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, Abriana Herron, and myself, Zach Bundy, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music. If you liked today's episode, remember to subscribe and share. And follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening, and we'll be back Monday.